colleagues, and my dear students. A very warm good afternoon, and we are delighted to welcome you to Ebenezer Group of Institutions for the opening ceremony of Faculty of Nursing International Webinar April 2022, Bangalore, Karnataka. The Faculty of Nursing consists of an international webinar version on Advanced Nurse Practitioner for Future Healthcare Solutions in India, an association with World Canada Nurses Welfare Association, British Indian Nurses Association, British Association of Physicians of Indian origin. This webinar to bring together academics, researchers, business entrepreneurs, practitioners, and policymakers who are responsible for delivering sustainable solutions through leveraging advanced nursing practices in the modern healthcare. Give of thy love, no way to know the word of what thou livest, and as no returning, and where thou thy pathway leads on earth, there thou shalt find the lamp of the light burning. The lights of heaven and positive voice brings the blessings to an occasion. I would like to welcome the dignitaries to the dais to inaugurate the ceremony by lighting the lamp. A dream written down, with a day it becomes a goal. A goal broken down to steps become a plan. A plan backed by action make your dreams come true. I would like to introduce Mrs. Neetu Villara, Director of Admission, Ebenezer Group of Institution. It's a pleasure and proud for us to have you here for the welcome address. Over to Mrs. Neetu Villara.
Nurse, just another word to describe a person strong enough to tolerate anything and soft enough to understand anyone. Very good afternoon to one and all present here. It's with great pleasure that I welcome you all to our international webinar to discuss the topic Vision on Advanced Nurse Practitioner for Future Healthcare Solutions in India. It's my humble privilege to welcome our distinguished chief guest, Dr. Roy K. George, National President, TNAI, Director Academics, Baby Memorial Hospital and Principal, College of Nursing, Calicut, Kerala. Dr. Roy K. George is one of the senior most professor in mental health nursing in Kerala and a PhD holder in behavioral sciences, has decades of experience in academic administration in colleges and universities in addition to his passion for teaching and research. He is the head of academics wing consisting of 3 academic institutions under the umbrella of Baby Memorial Hospital with School of Nursing, College of Nursing and College of Allied Medical Sciences. He is in charge of planning, development and administration of academic activities of different streams spreading over diploma, degree, post-graduation and PhD program in nursing and allied health sciences. We are happy to have such an accomplished personality with us here today. We wholeheartedly welcome you, sir. I take this opportunity to welcome our special guest, Dr. Ramachandra, former professor and head of Department of Nursing, NIMHANS, Bengaluru. Dr. Ramachandra has actively involved in the areas of nursing services, teaching, manpower development, research and administration. He has obtained PhD from NIMHANS, Bengaluru in 1997. Contributed few chapters in neuroscience nursing book and a textbook of psychology for BSc nursing. Awarded Rashtrapati Award on 12th May 2016 from Honorable President of India. At present, he is one of the Academic Review Committee members for INC and resource person for National Consortium for PhD and consultant for Clinical Nursing Services, NIMHANS. It is a privilege to have your distinguished presence with us today. We proudly welcome you, sir. I take this opportunity to welcome our keynote speakers for the day, Mr. Suresh Babu Periyasamy, ANP, Emergency Department, Leicester Royal Infirmary, UK. Suresh Babu Periyasamy earned his Bachelor of Nursing degree from Tamil Nadu, Dr. MGR Medical University, and Master of Science in Advancing Practice from Coventry University, UK in 2011. His close family and friends have always motivated him, where most of them are involved in the medical field in one way or another to serve the society. The great inspiration came from his mother as a community nurse during his primary education. As a passionate individual, he never stopped upgrading his skill sets for the last 2 decades with current advancement in nursing field. He is a highly experienced and advanced nurse practitioner. In the last 25 years of rich experience, not only has he become an independent nurse prescriber, but also has gained expertise in a variety of specialities, including intensive care, trauma, orthopedic, neurosurgery, sports medicine, coronary care, acute medicine, care of elderly, and emergency medicine. In the last decade, he has gained greater depth of experience as an advanced nurse practitioner in care of elderly and emergency medicine. We are extremely happy to have you amongst us today. We welcome you, sir. Our keynote speaker, Mr. Raghavendra Kamlu, is an advanced clinical practitioner, Accident and Emergency Department, Newham University Hospital, London. Raghavendra Kamlu hails from Udupi, Karnataka. His primary health care was done in Phoenix Medical Practice, Rochester. Advanced nurse practitioner from Bournemouth University, London. MSc in Advanced Nurse Practitioner from Bournemouth University, United Kingdom. His area of expert is and has experience in the role of being an advanced clinical practitioner, elderly medicine. He serves for the organization, member of Royal College of Nursing, United Kingdom. He is the founder member of Government Nursing Organization, Udupi, Karnataka. Founder, President of Vishwa Kannada Nursing Organization. Founder of Dorset Kannada Balaga. Founder of Executive Member of Dorset Indian Mela, Life Member in KNC. He was honored and won the Parimala Award from Mantrala in the year 2021. Most recently, he has been selected as a nominee for a professional award, Bot's Health Hero in 2021 towards professional contribution as ANP. We are delighted to have you amongst us today. We welcome you, sir. It's a great pleasure to welcome all other speakers for the day. Dr. Ramu K., Dean, RGHS, Principal, RR College of Nursing, Bangalore. Dr. Ramu has presented a research paper on type 2 diabetes at Tokyo, Japan, and on psychological problems among street children in foster homes, Dubai, UAE. He has published original and reviewed research articles both in national and international journals. We are happy to have you amongst us today. We welcome you, sir. Dr. Tracia Dennis, Principal, Ebenezer College and School of Nursing. Dr. Tracia has 19 years of commendable clinical experience among 40 years of overall experience in the work environment. Her achievements are not limited to her academic brilliance and professional work. She has been an author of multiple publications. Her thesis offers great insights into the field of healthcare. Her writings have the potential to change society for good. We welcome you, ma'am. Professor Sridhar KV, Principal, College of Nursing, Adarsh University, Punjab. We are happy to have such a brilliant personality amongst us today. We welcome you, sir. Dr. Vidya Raju Salyan, Principal of Nursing, Bowring and Lady Curzon Hospital, Bangalore. She has been graduated with MSc in Pediatric Nursing and also holds MBA in Hospital Administration. She has completed PhD in Himalaya University, Itanagar. Mrs. Vidya Raj Salyan has been awarded in 2012 as State Level Florence Nightingale. She was recognized for her hard work and performance and received the International Women's Day Award at Banquet Hall, Vidhan Sauda in the year 2014. She is a proud national award winner for all her achievements made thus far. We welcome you, ma'am. It's my privilege to welcome our dear chairman, an outstanding personality, Mr. Sanjeev Chincholi, who holds a robust academic background and is always far-sighted. We wholeheartedly welcome you, sir. Our dearest secretary, Mrs. Upasana Chincholi, Mrs. Upasana is a hard-working, relentless, and dedicated intellectual with a great educational vision. We welcome you wholeheartedly. I extend my warm welcome to Mr. Pankaj Roy, a man with a strategic mindset and well known in the education industry. We adore him as our executive director with an extremely creative streak. We welcome you, sir. I am delighted to welcome our CEO, Mr. Lofi Velara, a true leader, initiator, change maker, dreamer, and a passionate professional. We welcome you wholeheartedly. I am delighted to welcome Dr. Kumar KR, Principal, Ebenezer Management College, to this international webinar. Welcome you, sir. All our committee members, technical team, teaching and non-teaching fraternity of our college, and my dear students, a hearty welcome to you all. Lastly, I welcome all good things to this occasion. Thank you.
Thank you, Mrs. Neetu Valera, for your warm welcome, and we welcome you as well. It is the supreme art of the teacher to awaken joy in the creative expression and knowledge. Once Albert Einstein had quoted this. We are honored to have Professor Dr. Roy K. George, National President of Trained Nurses Association of India, Director Academic and Principal of Baby Memorial Hospital and College of Nursing, to address our listeners. We welcome you, sir, to address our audience.
Thanks for attending this inaugural function. Mr. Asia, the Principal of the Ebenezer College of Nursing. Resource persons attending various sessions. My dear friend Dr. Ramchandra, my senior in Limmans, and all the dignitaries. First of all, let me congratulate the Ebenezer Group of Ebenezer College of Nursing and School of Nursing for organizing a futuristic webinar on advanced nurse practitioner, the scope and challenges in India. As all of you know, nurse practitioner concept was introduced by Indian Nursing Council a few years back and is facing many roadblocks. In few institutions across India it was started, but unfortunately in many parts of the country, especially in some states like my home state Kerala, none of the institutions could start it due to the cost of objections raised by our close colleagues in the healthcare doctors, the medical doctors. There are many reasons for them to object it. But in the Nursing Council, with the support of the Government of India, is going ahead with the implementation of nurse practitioner in critical care as well as the nurse practitioner in community health. Of course, there are procedures going on to start the same thing in the advanced maternity care, where nurse-led clinics are already started in some of the country. Like now or in the near future, this is something which is essentially required for a country like India, which many countries like UK, USA and Canada have successfully implemented. And changes in the sector are many times meet with resistance from some of the quarters. But as all of us know, change is the only permanent thing. And nurse practitioner, at least in some of the very important areas, is a highly essential requirement to provide good quality healthcare to people of India? This one question as TNA National President I usually ask in many forums. Anyone in the government or policy making body or prominent leaders talk that nurses are one of the largest export human resource of India, and India continues to lead as the nurse exporter to the world, the main source of the largest source still now, in spite of the shortage of nurses in India due to multiplicity of reasons. So I do usually ask, are our fellow citizens are not qualified or eligible enough to receive the best quality nursing care that Indian nurses are famous around the world? Are we not up to that level? Is it because our nursing is not that level, or because of the people at public? So this is a question where many times people get flimsy reasons to prevent nurse practitioner care, especially critical care. All of us know that critical care areas, especially high dependency ICUs and all, though there are specialists or super specialist consultants who are competent enough even in the international level to prescribe treatment, to provide 24-hour essential support. We have very junior doctors who have no experience in handling patients, and there are corporate hospitals in this country which uses Ayurvedic or Ayush doctors to manage ICUs because of lack of unavailability of specialized doctors in the junior level, because they come and leave within next PG examination, and they serve the ICU for 3 months or 6 months and have practically no experience in managing critically ill patients. There are nurses who have 10 or 20 years of excellent experience, who have engaged the consultants in detecting a problem early or making an intervention, but they are not certified enough because of our legal issues in this country. That's why the Ministry of Health, Government of India is strongly advocating for nurse practitioners in critical care. And the advanced nurse practitioners is another level ahead, where it is second level or second tier, where nurse practitioners are given more independent role or more autonomous role, which has been time tested practice in many countries. And definitely, there may be delays, but it is going to come in India, and this is a very good occasion to deliberate on that. So at least nurses ourselves will be able to identify the prospects, the challenges, and strongly talk and lobby for these things, because change, even sometimes it is slow, it has to come by mass movements, and we need people who knows what is the benefits, what are the challenges, what are the problems in implementing this. These things are always required. Brainstorming sessions like this, and I am happy to learn that this program is organized by the supported by World Canada Nurses Forum, British Indian Nurses Association, British Association of Physicians of Indian Origin. All these three organizations are having a lot of experience from the implementing these programs, and they will be able to share valid inputs to all of us. So congratulations and thanks once again to the organizers, and as the national president of the professional association, which have been advocating for a more professional status, autonomy, and after all, with the overall aim of ensuring quality care to public in Indian society who are remaining in India, not all over the world. That is also another part. But then we have to strongly advocate definitely for improving the nursing practice in this country, ensuring the better quality of nursing care, and retain our best nurses in India to care for our people. So this is a vicious cycle where nurses leave because of many reasons. One of the reasons are no proper career advancement opportunities in India, whether in the government sector or private sector. These are things which will motivate and inspire people to come up to higher levels. So this is the best time, there's a Japanese saying, the best time to plant a tree was 20 years ago, because by 20 years it will give fruits and shades for the people. But the next time is now. That's what Japanese. So this is the next time, or the best time to do it, because nobody has done it 20 years before. So I congratulate the organizers for being an early bird in discussing things of current relevance, and will keep us updated about what is happening in other parts of the world and how we can implement. I'm very sure that the sessions will be very useful for the participants and will enlighten the people. They will take home with good messages and will be able to work in their respective areas with more vigor and comfort and more confidence in the concepts which are shared here. Thank you very much for giving this opportunity to address you on this occasion, and I declare our all-hearted support for DNA support for any movements in strengthening nurse practitioner programs or advanced nursing practitioner courses anywhere in India. Thank you very much.
Thank you, Dr. Roy K. George, for your warm wishes and for quoting the importance of being a nurse practitioner. There is nothing like a concrete life plan to weigh you down. Because if you always have one eye on some future goals, you stop paying attention to the job in the hand and your opportunities. Stay fixed on your path, leads you newer opening. I'm pleased to have tremendous person to address the gathering, Dr. Ramachandra, former professor and head of Department of Nursing, NIMHANS, Bengaluru, to speak on transforming nursing practice. We welcome you, sir, to address the audience.
Gurave Sarvalokanam Vishade Bhavaroginam Hridaye Sarvavidyanam Dakshinamurte Namaha. Namaskara. Good morning to the viewers in UK and European countries, and good afternoon to viewers in India and Australia. I sincerely thank the organizers, Dr. Tracy Amma and Mr. Raghavendra, for giving me an opportunity to share my views. Of course, the most important of this thing is now the transforming nurse practitioners practice in India. Now, nursing is one of the most versatile occupations within the healthcare workforce. Of course, the nursing is one of the noble professions. Lina in 2008 has told that new career pathways, of course, are very important, but Florence Nightingale developed and promoted the concept of an educational workforce for caregivers for the sick. Of course, modern nursing has reinvented itself a number of times as healthcare has advanced and changed from time to time. Of course, Aiken et al. Again in 2009 told that new career pathways for nurses have evolved, attracting a larger, more broadly talented applicant pool, leading to expanded scopes of practice and responsibilities for nurses. Nurses have been an enabling force for the change in healthcare along many dimensions. So now, with this, with every passing decade, nursing has become an increasingly integral part of healthcare services, so that a future without large number of nurses is impossible for envision. Nurses have had the opportunity to play a central role in transforming the healthcare system to create a more accessible, high quality and value-driven environment for the patients. If the system is to capitalize on this opportunity, however, the constraints of outdated policies, regulations and cultural barriers, including those related to scope of practice, will have to be lifted, most notably for advanced practice registered nurses. Now, the most important is the delivery system, of course, is the most important to look at. The possibility of thing where the persons have already been told what is the being observed in different thing. Now, the National Health Policy in 2017 recognizes that redesigning the healthcare delivery system and establishing carers like nurse practitioners and public health nurses to increase their availability in more needed areas. Of course, JP Naddaji also was propagating about this particular aspect. The National Institute for Transforming India, the Niti Aayog strategy for New India, which is very important, and have constituted some ideas. Our country's workforce experts agreed on growing wide gaps between the populations and demand for primary care physicians. The introduction of the nurse practitioner role is a better way to meet these challenges. And then, of course, the Ministry of Health and Family Welfare emphasized that nurses occupy an essential position in the healthcare delivery. They can be utilized equally to doctors when we think of achieving the sustainable development goals, according to J.P. Naddaji, who propagated this particular issue to a very important topic to nation. The union government is actually the thinking considering creating a cadre of nurse practitioners to address a shortage of nurses in rural areas. Now, in many aspects in India, some aspects are going to be considered very seriously. Of course, the roots of unorganized and unregulated nurse practitioners can be found in states like Rajasthan. Many RNs practice as general nurse practitioners, especially in rural areas, though it is very well accepted by the public but not legalized. In the year 2002, the government of West Bengal was the first state in India to restart the nurse practitioners in midwifery course under the India ASAID project, provided training for 18 months to diploma and graduate nurses, yet unable to obtain due recognition. On a track, Gujarat's government started in 2009 and sanctioned 25 posts of independent midwifery practitioners, but still waiting to appoint. In my experience, of course, when I had been to America about 15 years back, for my daughter's delivery, and I could ask who is the obstetrician and gynecologist that you have approached. Now, to my surprise, she told me about 15 years back that she has already approached to a nurse practitioner midwife so that she could look after her. Now, I talked to that person midwife, and I was really convinced about her skills and the knowledge that she possessed. And of course, my daughter for second delivery also, she approached the same professional, and it was really good enough to see comprehensive care was given. Now, the policy process was delayed for several reasons in India, includes less drive and shared vision, unconfined about developing an autonomous cadre of midwives in India, and less space for open dialogue. Similar steps to train registered nurses in NPM by Telangana, Kerala, West Bengal and other states. However, it could not attract the candidates due to the absence of clarity about registration with the nursing councils, the scope of practice and employment. The government also came up with some expanded roles for nurses through the nurse-led healthcare delivery models. Few institutions in India took up this model of nurse-led clinics, and few extended their roles like stoma nurses, stroke nurses and public health nurses and diabetes nurse educators. But they are trained in-house and their titles are not protected by any legislation. Now, in this context, we need to be very careful how to move about. The Indian Nursing Council implemented nurse practitioners in critical care program with approval of Ministry of Health and Family Welfare all over the country since 2017 to expand the role of registered nurses. Indian Nursing Council has signed a memorandum of understanding with University of Houston, a College of Nursing, in April 2018. The nurse practitioner, his role is promising in India. However, the implementing role of in a multi-professional structure is a complex and recurring task in the country. Nevertheless, it is possible with meticulous planning and execution through strong legislation, a licensure with a clear scope of practice, and the career pathways to nurse practitioner's course. The key factors that will contribute to the success of managing such a transition include technological literacy, good communication skills, and adaptability to organizational changes, and a willingness to evaluate and reinvent how work is organized and accomplished. Now, going forward under the ACA and whatever reforms may follow in the health system is likely to change so rapidly that building the adaptive capacity of nursing workforce to work across settings in different types of roles in different newer model of care will require intentional development, expanded resources, and a policy and regulatory changes. Finally, the Institute of Medicine in America Committee on Robert Wood Johnson Foundation Initiative for Future of Nursing believes that if practice is to be transformed, the nurse graduating with bachelor's degree must be prepared to enter the practice environment and confront the challenges that will encounter. Therefore, the committee concludes that nurse residency programs should be instituted to provide nurses with an appropriate transition to practice and develop more competent nursing workforce. So in this regard, Indian Nursing Council also strongly believes that residency programs are extremely useful. So this will go a long way so that the nursing practitioner will be transformed into a better healthcare workforce. Thank you very much.
Thank you, Dr. Ramchandra, for being the part of our effort and discussing on transforming nursing practice. If your action inspires others to dream more, to learn more, and to do more, to become more, then you are a leader. We are privileged and honored to have a well-recognized person who renders selfless services to health achievement. I would like to invite Mr. Suresh Babu Pariyasamy, Advanced Clinical Practitioner, Emergency Department, Leicester Royal Infirmary, United Kingdom, to talk on concept of advanced nurse practitioner in healthcare. Mr. Suresh Babu Pariyasamy, please be on the dais.
Hello everyone, my name is Suresh Babu Periyasamy. I'm an advanced nurse practitioner from the UK. I would like to invite you all to join the upcoming international webinar organized by the Ebenezer College of Nursing. Don't miss it. I'll see you all this Saturday. Thank you.
Hello everyone, good afternoon. I'm Suresh Babu Periyasamy, Advanced Nurse Practitioner from the UK. I'm one of the executive members for the British Indian Nurses Association. I would like to welcome everyone for this international webinar. The chief guest, Professor Dr. Roy George, and the special guest, Dr. Ramachandra, and all other keynote speakers and other speakers and delegates and participants for this wonderful event organized by Ebenezer School and College of Nursing. I would like to say a big thank you for them to organizing this webinar about advancing nursing practice, and also thank you to Mr. Laufey and Raghavendra giving me the opportunity to speak here today. So I would like to talk about the advancing nursing practice, the concept of advanced nurse practice, where it started, how it came into other country. So I will share a slide and you can able to see. I hope you can all see these slides, yeah? So I'm just going to talk about advanced nurse practitioner. So the history of advancing practice, where is the advancing practice started, how it spread into other countries, and what is advanced nurse practitioner? So the definition of advanced nurse practitioner, and provide you a better understanding of the role of advanced nurse practitioner, which is expected in United Kingdom to become an advanced nurse practitioner. Advanced nurse practitioner, the concept is huge, and every country they have their own scope of practice and frameworks. And I don't want to give you too much information, but I wanted you to make it simple and have a good understanding about advanced nurse practitioner. So the concept of advanced practice, it's created in the United States of America in 1970s. So they are the creator of this advancing roles, 1970s. So normal nursing practice, they wanted to get the nurses to cross the boundaries into the medical practice, and that's a concept, and they have created this advancing practice roles. There are lots of different roles they created. I will explain it later in the slide. Then after it started in the United States of America, it spread into the other countries. So it was spread into Canada, New South Wales, Western Australia, and New Zealand. So in USA, in Canada, it started in 1970s. Australia, it came into practice in 1990. And New Zealand at the same time of 1990s. So it started there and came into the United Kingdom in 1980s, first in the emergency department. Then in 1981, it came into the primary care sector. So emergency department is like accident and emergency department. So back home in India, we call casualty. So primary care is the community health care. So in most of the countries, in all of these countries, the reason for the advancing practice roles are similar. So the drivers for the advancing roles, mainly due to the patient demand of quality care and decreasing manpower. So particularly if I say about the European Working Time Directive, so that came into place. So junior doctors used to work a lot of hours per week. So the European Working Time Directive came and reduced the number of hours for the junior doctors working. So what happened? People are working like 60, 70 hours. They put it down to 45 hours. So there was a huge gap. So the lack of manpower in the healthcare sector, and also rapidly changing the healthcare systems and changing health policy. So there are lots of new policies came into the last 2 decades. For example, I can say some like a simple example. So patient needs to be seen within the A&E department within 4 hours, 15 minutes to be triaged. So you need to meet those demands. So you need more workforce to deal with this demand. And also aging population. So nowadays people are living longer with chronic conditions. So the demand is huge. So the drivers for advancing roles in all these countries, these are the reason for them to bring these advancing roles, get the nurses into the higher level of practice. The scope of practice and role title and role autonomy, it's hugely different to every country. So every country, they have their own scope of practice, the advancing practice framework, and also the names they call for advancing roles and how they work. So I'm just going to give you some little examples here. So initially in USA, they called advanced practitioners, APN. Then they called nurse practitioners. Then also there are clinical nurse specialists. Like in India, you just mentioned about critical care nurses. So clinical nurse specialist and emergency nurse practitioners, then advanced nurse practitioners. So there's a lot of roles within the advancing practice roles. So the clinical nurse specialist, they are super specialty, single specialty nurses. Example, they have a CNS for diabetic nurse specialist. So they are specialized in diabetic and they look after the patients in diabetes chronic conditions. There are some other clinical nurse specialists like anticoagulation DVT nurse specialist and also COPD nurse specialist. So renal nurse specialist, dialysis nurse specialist. So they have a lot of specialty CNS there. Then they have emergency nurse practitioners. So ENPs, emergency nurse practitioner, they work in the emergency department. They see purely mainly minor injuries and minor illness. Then they came with advanced nurse practitioner role. So advanced nurse practitioners are similar to the junior doctors or middle grade doctors. So they see every patient presented to the hospital with any conditions. So it depends where they work. So you have advanced nurse practitioner like me and Raghava working in the emergency department. There are advanced nurse practitioner working for care of elderly older people, advanced nurse practitioner in cardiothoracic, advanced nurse practitioners in orthopedics. So every specialty, they have their own advanced nurse practitioners to look after their specialty and provide the high quality and safety care for the patient. You can see I put it on the bottom, it says advanced clinical practitioner. In the last 3-4 years, the demand was getting higher and higher, and advanced nurse practitioners as nurses are not maybe enough people to deal with this. So the government came up with idea. So they wanted to bring in other professional into these advancing roles. Like physiotherapists and paramedics. So paramedics are trained ambulance crew, paramedics, and also some pharmacists. So what they've done is they put them through the same courses. They all came in there. Because you have the multi-professional here, not only nurses, you have physiotherapists, pharmacists, and paramedics. So they changed the name into Advanced Clinical Practitioners, ACPs. So Advanced Clinical Practitioner consists of nurses, pharmacists, physiotherapists, and paramedics. So this is the history and concept of advancing practice. So it was created by United States of America in 1970s and spread into other Western countries and came into UK in 1980s and 1991. And there are lots of different types of roles within the advanced practice. Now we have advanced clinical practitioner consisting of multi-professional people. I hope this makes sense. So I'll go into the next one. So what is advanced nurse practitioner? Who is advanced nurse practitioner? There are lots of definitions for advanced nurse practitioner. So I have just put a couple of definitions here from UK. So there are one from Royal College of Nursing. There are lots of other definitions from American Association of Nurses, International Nursing Council. So there are lots of definitions for advanced nurse practitioner. But I'm just going to talk about a couple of things here. I'll just give maybe like 10 to 15 seconds for you to just look at the definition of the top one. So the NMC definition says advanced nurse practitioners are highly experienced and highly educated members of the care team who are able to diagnose and treat your healthcare needs or refer you to an appropriate specialist needed. They did not say how high experience, but they just said you are a senior member of the nursing person with lots of experience and you have an educated master's level who can able to do like a doctor's job, diagnosing, treating, and referring patient. But the RCN definition, Royal College of Nursing, bit more elaborated the definition. The same definition, but it's more clear. So advanced nurse practitioners are educated at master's level. So they have specified you need to have the master's degree in clinical practice, advancing practice, and have been assessed and competent in practice. So it's not only just completing master's, you become advanced nurse practitioner. You need to have the competency and the skills to practice within the own specialty. So they're saying educated at master's level in clinical practice and have been assessed as a competent in practice using their expert clinical knowledge and skills. Advanced nurse practitioners have the freedom and authority to act, making autonomous decisions and also diagnosis and treatment of the patient. So basically, it tells you like you're like whatever the doctors do, that's what you're doing. So you can see, assess a patient and diagnose the patient and treat the patient and discharge the patient. So basically, you do the same as the medical doctors, what they do. That's what advanced nurse practitioners. As Professor Dr. Roy mentioned about senior nurses who works in the department a long time have the more knowledge and experience compared to a newly qualified doctor or junior doctors. So as advanced nurse practitioner, when you are in your own department, you are there for a long time. So the doctors rotate, they just come in, junior doctors, and you have the more knowledge and expertise than the junior doctors. So this is the definition of advanced nurse practitioner. So educated to a master's level and have a high experience who can able to diagnose, treat, and refer a patient and treat the patient and discharge patient. So the advanced nurse practitioners, there is no particular definition. You need to have 5 years experience or 10 years experience before you become advanced nurse practitioner. But in my experience, because the concept came in recently and in the last 10 decades, so most of the advanced nurse practitioner had minimum 10 years experience before they become an advanced nurse practitioner. Some of them now recently have like 6-7 years experience, but most of them had a minimum 10 years to 15 years before they become advanced nurse practitioner. And in UK, we have the grading system for the nurses. When you qualify, you are a newly qualified nurse as a staff nurse on a ward, you are a band 5. The next level is a band 6. That will take at least 2-3 years to become a band 6, which is like a deputy ward manager. And a band 7 is the ward manager. So that will take you 4-5 years from a qualification to become a band 7 ward manager. The same in India as well. If you want to become a manager of your ward, it takes like few years for you to become. The reason I'm saying all these bands, advanced nurse practitioners are band 8A. So from band 5 to become a band 8A, that journey will give you few years experience. Then you got a master's degree to do 3 years. So that will take you, at least that will give the relevant experience within your particular specialty. So you automatically become a highly experienced nurse within your specialty. Then UK have now lots of universities, most of the universities, they have the MSc Advancing Practice master's degree. Recently it's been, they're trying to put the same module and same program for every university. It consists of like 7 modules. So you need to have advanced health assessment module. You need to have one module is advancing practice. So you learn about what is the advancing practice, concept of advancing practice, history of advancing practice, everything you learn in that. The health assessment model is they teach you to do a head-to-toe assessment, examination, and also history taking. Then you have some specialty module that whichever specialty you are working, you have that the diagnosis or the medical condition taught to you. Then part of the master's, you will be doing your prescribing course. So UK, the NMC, the Nursing Midwifery Council has approved nurses to become independent prescriber. So some universities, they do part of the master's, some of them, they do the master's and do the prescribing course separately. So you will be registered with the Nursing and Midwifery Council as a nurse, and also you will be like registered as an independent nurse prescriber. So you have the master's, then you have research module, and you have leadership module, because as a senior nurse, as a practitioner, you're expected to have leadership qualities and management qualities and everything. So the expert clinical knowledge and skills. So once you've finished your master's, you automatically, technically, you are an advanced nurse practitioner as a qualification. But to gain the expert clinical knowledge and skills, you need to have practice and experience within that specialty. As I mentioned earlier, there are lots of specialty like accident emergency department, care of elderly, orthopedics, cardiothoracic, and all the specialties. When the advanced nurse practitioners finish the master's, they work in that specialty, and they have specialty specific competencies. They need to be signed off by the clinical supervisor. For example, so if you're working in A&E, so you need to have signed off expert in all medical presenting problems like abdominal pain, chest pain, head injury, major trauma. So much is that. So I don't want to go too much detail in that. So you have experience, you do the masters, then you have the qualification as advanced nurse practitioner, then you work and gain your knowledge and skills to signed off as an independent autonomous practitioners. So when I come into autonomous practitioner, you are expected to make autonomous practitioner is independent practitioner. So you make your own clinical judgment, you make a decision making, you decide diagnosis, admission, discharge, or refer to a specialty. So although obviously you always need to discuss with the senior member of the staff within the department, as you are expected to be autonomous independent practitioner as an advanced nurse practitioner. So you gain the prescribing qualification as an independent prescriber. You are registered with NMC as a prescriber. Initially, every hospital, every trust, they have their own scope of prescribing practice for individual AMPs. Now it's become a bit better. Initially, when I qualified like 10 years ago as an AMP, we had restriction. I have a list of medicine that I can prescribe. But NMC says I can prescribe anything within my own competence, what I can prescribe. So now every trust and the departments are happy for advanced nurse practitioners to prescribe most of the drugs. We can prescribe anything from the British nurse and a national formulary. So we can prescribe everything, mostly we can prescribe. But you need to have some knowledge and competence. You need to have regular update on your prescribing. And so I work in A&E. For example, I won't initiate somebody who has got a mental health problem first time starting a drug for them, because that's not my expertise. So it is that you judge what you can prescribe, what you can't prescribe. So that is mainly how the advanced nurse practitioner work. The most important, the advanced nurse practitioners, they work within these 4 pillars of advancing practice. This is the very key information. Please remember and Google, that's what they all work towards. So the role of advanced nurse practitioner falls into 2 categories. One is clinical, which I have explained everything to you. Another one is non-clinical. The clinical work is purely seeing patient, taking history, assessment, examination, ordering appropriate investigation. So I can request a CT head, CT abdomen, CT trauma, CT. I can request all X-rays, all body part X-rays. I can request ultrasound, everything. So I need to have the knowledge to interpret the investigation that I have ordered as well. And also prescribing, making diagnosis, and making autonomous decision whether I admit this patient or I'm going to discharge this patient with some medication, or I'm going to refer to specialty. So somebody has a fall coming, assessing the patient, they have fracture on X-ray, then refer to orthopedics. Or somebody comes with chest pain, they have raised drop or ECG changes, then prescribe and refer to cardiologist. So that is what it is from any department. You make that decision as an autonomous independent prescriber. So that is one part is clinical. The non-clinical, so other 3 pillars, I will go through the next slide. So the 4 pillars of advancing practice. So clinical practice, facilitating learning and education, leadership and management, and finally audit and research. So these are the 4 pillars of advancing practice that every advanced nurse practitioners on all the advanced roles will work on based on these 4 pillars of advancing practice. So they try to balance. You can see the picture on the second picture. One is higher than other one. Research is a bit lower. So it varies on your clinical practice and where you work. So sometimes you're more clinical, you see patients, and less participation in teaching and auditing. So everybody try to balance and have opportunity to practice in these 4 pillars of advanced practice. So facilitating learning, that is education and teaching. So as an advanced nurse practitioner, you are a senior clinician. You are expected to create a learning environment for the junior staff and other staff members and teach them, involvement in teaching. So you can do formal and informal teachings. So I personally get involved in, I used to teach in the MSc advancing practice program for the first year student, head to assessment, we do the teaching, and lots of other teaching within your own specialties. You do teach quite a lot. And also you have the qualification of mentoring. This is one of the requirements to be a mentoring qualification. So you do mentor a junior trainee ACPs or ANPs. So facilitating learning and teaching is very important as one of the key role of the advanced nurse practitioner apart from your clinical practice. And leadership and management, and also auditing and research. So as advanced nurse practitioner, you are expected to be part of any local auditing or national auditing, and you identify some issues with your clinical practice, come up with some solution, doing auditing, come up with a plan, service development plan that falls into the leadership and research. Next slide is going to be a bit busier, but I'll just explain simply. So the management and leadership number one, I'm not sure whether you can see that clearly, but so basically as advanced nurse practitioner, your role as a management and leadership, one pillar is identifying the need for change within your practice. So leading innovation, coming with some new ideas, managing the change, and come up with some service development programs or participation, and coming with the new plans, developing case for a change. That's very important. So you need to bring up a lot of changes to improve the quality of the patient care and the service in your own area. So you need to have like negotiation, influencing skills, networking, team development. So I already said about education, research. So advanced nurse practitioners work within the 4 pillars of advancing practice. So to summarize, I just wanted to give you an overall summary. So advanced nurse practitioners are senior nurses, experienced nurses who has got a master's degree and independent prescriber. They work autonomously, and mainly every country and every hospital and trust, they have their own scope of practice or a framework for advanced practitioners, and everybody works in the 4 pillars of advancing practice. I hope I've not given too much information to confuse you, but I think this will be very useful for all of you and give you some insight and vision about advanced nurse practitioner and what they do. I wish you all the best, and thank you for listening.
Thank you, Mr. Suresh Babu Paresame, for your wishes and compliments for Ebenezer Group of Institution. Thank you for discussing the concept of advanced nursing practices, its aims, objectives, scope, and the detailing the versatility in advanced nurse practitioner. Thank you so much, sir, for being the part of this. Leaders are made. They are not born. They are made by harder foods, which is the price which all of us must pay to achieve a goal. That is worldwide. We are honored to hear from Dr. Ramu K. Dean, Rajiv Gandhi University of Health Science, Principal, RR College of Nursing, Bengaluru, to speak on the topic, Facilities for Implementation of Nursing Practice in India. We welcome you, sir, to address the gallery.
afternoon, everyone. Respected dignitaries and delegates. First of all, hearty congratulations, Ebenezer Group of Institutions, for selecting this excellent topic. At present is a burning issue, right, in India. Excellent topic you have taken. Congratulations, Dr. Teresa, Madam, the principal and staff. You know, just now our speakers and guests have spoken about the definition of nurse practitioner or advanced nurse practitioner, also known as the role of advanced nurse practitioners. You know, before going to know about the nurse practitioners in India, right, the role of nurse practitioner in India, one of the speakers just now mentioned the definition. I'm not going in that. See, the role of NP, nurse practitioner, you know, this collection of history, physical examination, right, and ordering the lab test, giving treatment, right, and references, and the health education, and very, very important, perform certain clinical procedures like bone marrow autopsy and lumbar puncture. So, this is very important role of nurse practitioners here, right? Of course, where this nurse practitioners are working, you know, they're working in almost all the areas like cardiac, neonatal, pediatric, psychiatry, right, public health, critical care, and almost all. You know, in developing countries today, they're facing serious workforce challenges in health sector, in availability of physicians, right, which availability of the physician, which leads to damage of healthcare services. And whereas in developed countries, right, no doubt in that, they have succeeded in demystifying the nursing, the medical management of patient care, right? And very important, these developed countries, they have replaced the non-physician practitioner with advanced nurse practitioners, as just now one of the speakers have mentioned clearly that, right? So these advanced nurse practitioners, they're replacing the physicians in the clinical area, of course in the community area also. They are working, right, and they're maintaining the quality of care. I'm happy to say that the many research, the meta-analysis, and even the many studies says that, right, almost plenty of research studies on role of nurse practitioners. All the says that the patients are very happy, they're satisfied with the quality of care that is provided by the nurse practitioner than the physician, right? And they're equal. The role of nurse practice almost is equal to the physicians, and the public is very happy about that. You know, regarding before going to in India, the role of the role of nurse practitioners. So what about other countries? You know, as a speaker has told, National Health Services, the NHS, the National Health Service System in UK is completely depending on this nurse practitioners since 1980. Whereas in USA, the health system also depending on the nurse practitioners since 1960. Of course, Australia, Netherlands also, they're completely, the role of nurse is very effective. Australia, they're depending on nurse practitioners since 1990, whereas in Netherlands, they're depending on the nurse practitioners from 2010. Of course, in New Zealand, Canada, they're all well equipped. I mean, the nurse practitioners are really, they're having very good recognition compared to India. Before going to know the nurse practitioners in India, I would like to mention a few of the things. You know, the healthcare sector needs, right, are growing with increasing population size, right? The dual burden of diseases, chronic diseases and lifestyles. So which leads to lot of the problems, especially the damage of the healthcare sector and the increasing morbidity and mortality rate. We can see this especially particularly in the COVID pandemic. Right? You know, the nurses are the backbone, are the pillars of any healthcare system, right? But very sorry to say that the nurses who are graduated from India, right, are migrating to Eastern and Western countries. Why they're migrating? Lack of support, lack of encouragement, no doubt in that, and low remuneration, and no job security in India. right? These are the main risk factors. There is a reason why they're migrating. There is a freedom, right? And here, I would like to mention one more point here. Very, very important. I told just now, lack of support and lack of encouragement. You know, in 2014, what happened? There is a strong opposition by the doctors. Strong opposition by the doctors for the inclusion of our nurses in MTP, Medical Termination of Pregnancy Amendment Bill 2014. Just imagine, they are not allowed us to include in this act. So which reflects the attitude of nursing cadre, right? So after, as Dr. Raj just told, after introduction of this, the cadre, two nursing cadres, nurse practice in public health, nurse practice in nurse practice in critical care. After introducing these two cadres, the lot of advancements we can see in nursing profession. You know, and very thing I would like to hear comes to here in Indian scenario, right? We can see, you know, the nurse practitioner program was started by the government of West Bengal in 2005, right? So that is called as nurse practitioner in midwifery, NMP program. So of course, this is for the nurses, for those who have completed the diploma nursing or graduate nurses, and they're given the government under Ministry of Health of Government of West Bengal, they're given the training to such nurses. But very unhappy to say that up to 2010, there is no recognition for this program. So what happened in 2010, 9 to 10, the Gujarat government also started nurse practitioner. So it is called as basic, post-basic diploma in nurse practitioner in midwifery. That followed by, of course, the government of Telangana, government of Kerala. So the Indian Nursing Council has supported this government of Telangana and Kerala also for this training purpose. So helped us even along with the governments. And very important other point I would like to hear here is, you know, you might have heard this JPAGO, right? The JPAGO, it is a the non-government organization. What happened? So this JPAGO in India, right? So the main role, you know this, the main role of the JPAGO is, right, making public health programs, arranging the public health programs and improving the quality of public health. Especially, keep it in mind, this JPAGO also played a very important role by using these nurse practitioners. They're improving the quality of mother and child health care. That is the reason why the morbidity rate, the maternal mortality, infant mortality rate also has come down, right? And you might have seen this national health policy, right? Recent national health policy included, just now I told, includes two cadres, right? That is nurse practitioner and public health nurse. So the Union Ministry, right, Health and Family Welfare, it has recognized these two courses. And very happy to say that, right, Indian Nursing Council, just now as Dr. Rajaj has mentioned, Indian Nursing Council, right, initiated and it was launched by World Health Organization also, right, the Nurse Practitioner in Critical Care program, MSc in critical, that's called NPCC program, and it was launched by Minister of Health and Family Welfare. Government of India has approved that, and also it is in the website. Of course, it is all the health universities are running this course. Even in Karnataka also, we're having this NPCC program. And, you know, this Government of India launched Ayushman Bharat, that is called, also known as Pradhan Mantri Jana Arogya Yojana, right? So, this what they have identified is this scheme, the healthcare professionals having low training and they don't have much quality. So, what happened with the help of this health sectors, they improved the training and giving they given good training to the nurses and improved the quality of care also. And especially very important, under this program, Pradhan Mantri Rozgar Yojana program, so very important is the Government of India also launched middle health program, right? that's called as a mini doctor in India. You can call it as nursing health officer. You can call it as. So the central government has given complete. Of course, they launched that program because 80% of people in India are living in the rural area. So this program was started, and who is eligible for that? The nurses who, after taking this, after going this training, this public health, healthcare program, that's called community health officers. So they're working in this rural health areas on improving the quality of care. But very important, sad to say that there is no freedom for them also. Even while giving the treatment, while prescribing the medications also, they have to depend on under the supervision of the doctors. They're doing that. So, so finally, in 2016, the central government has, of course, they launched two programs. That is nurse practitioner in critical care, nurse practitioner in public health. So we'll wait and see what these two programs, with these two cadres nursing programs, really very good recognition in the public. They are doing excellent job. These two, the nurse practitioners, very good, and also the patients are. Many research says that they're satisfied with these two cadres, and also the quality of care also is improving. So anyhow, thank you so much for giving this opportunity. I'm very happy I'm very happy and proud to say that Ebenezer Group of Institutions always doing very good, what you can say, the social service. You are touched the public, not only touched, you have improved the quality, and you have giving health education. That's what I gone through this, not only your brochure, even I've gone through the videos, and even I came to know from the public also, you're improving the quality, the public health also. Anyhow, thank you so much for giving this opportunity. Thank you so much. Have a nice day and be safe. Thank you.
Hi, I'm Raghavendra Kamlu, Advanced Nurse Practitioner from London. As a nurse, as a student, it is very important to attend this webinar. Please come and join. Thank you very much.
Thank you, Dr. Ramuke, for putting forward all your efforts, even in the busy schedule, to be the part of Ebenezer Group of Institution. And also for all your lovely words and wishes for our students and for our group. We really thankful for giving us the information regarding the facilities that have to be provided for the nursing profession in India. Thank you so much, sir, for your valuable informations. To do what nobody else will do, in a way that nobody else can do, in spite of all we go through. That is what it is to be a nurse. I would like to call upon Mr. Raghavendra Kamlu, Advanced Clinical Practitioner, Accident and Emergency Department, Newham University Hospital, London, to speak upon developmental roles and challenges in Indian nursing. We welcome you, sir, to address the gallery.
Yes. Yeah, I'm there. Okay. Okay. Good morning and good afternoon, India. Means namaste is the same word for, for everybody. So we are the International Indian Nurses. We want to give back to our mother country. We wanted to contribute through improve the professional standard. On this way, to improve our nursing professional practice, to support our nursing student and nurses to take international opportunities, to provide or transferring our skill and knowledge from the international level to back home. It is our aim. That's the reason we are all international nurses, various groups like World Canada Nursing International or British Indian Nursing Organization or any international Indian nurses. Our aim, we want to give back to our country something. That is the reason this webinar. I requested Dr. Lopez sir, who is the CEO of the Webinar Institute. It's really great. He's very motivated. He's very interested, to take this opportunity to do something for nursing professional. I'm really thanks to the even Teresa. She's also really, very supportive, very coordinative. She supported throughout this webinar. Before starting, my speech, the I'm working as advanced nurse practitioner. I've been last 28 years in this profession. And the last 8 years, I'm working as an advanced nurse practitioner in India in the various areas like emergency, accident emergency, elderly care. Plus, currently, I'm working both sides, primary health care and emergency, immense accident and emergency department. My colleagues, Suresh Babu, he already said about advanced nurse practitioner. What is the advanced nurse practitioner? When it started? What is their concept, scope, and what they are doing in the clinical practice? So I would like to talk regarding how the development, how we can develop the role in the practice. What are the challenges? What we need to be learned, what we need to be, theory and practice, how we need to be, bring in the practice. So that one I'm going to be share with you. Got some problem in the sharing. Hello, is sharing now? No. Not sharing. Oh, 1 minute. Enter screen. I'm looking. It comes. This one is enter screen. So share. Yeah. Okay. It's sharing now. It's coming now. It's sharing. Okay. Hello. So this is the ENP role development. It is very important. My colleague Suresh already told you, what is the meaning of the advanced nurse practitioner, how it started, how it spreaded to everywhere. It was started from 1970 in America. Now it is coming to India. You all people need to take this role. You need to develop the role in the clinical practice. You need to understand how to develop this role within the clinical practice. It's very important to develop advanced nurse practitioner role development is challenging, and we have to take that challenge and to take this, the opportunity and to practice in the future. So there's the aim of this, this one is to how to implement, understand what they're learning, understand what are the challenges in the front of our, before we start this or when we start advanced nurse practitioner role. So what is role development? So the so many different understanding, different definitions, different areas it came, but I don't want to share all this, the definition. Just wanted to understand simple meaning of the role development. Role development is, so we are working as a staff nurse, we are working as a senior nurse. Already that role is already there. There is, but we are the advanced nurse practitioner. We are working the extended areas of the practice. We are practicing many years as a nurse. We are going to take additional role means additional practice. So that is called the extended practice or role, the new role. In that role, we need to have the competency, or we need to be going to practice that role. We need to start the new role development. That is, in our nursing practice. Okay, next. So professional development. So it's meaning there are 5 key tasks there. So state your professional activities and roles. Identify your current roles and responsibility. Assess skill and knowledge. List your skill and knowledge. Set goal. Write your professional and personal goals. Create an action plan and document your development. So this is a professional development. You need to understand what is your strength and your opportunity, what you are going to contribute in that new role. For example, if you're working as a staff nurse or senior staff nurse, what are the skills you got in your hand, how you are going to be implementing the new role. So you need to understand that this one. So I done the SWOT analysis. I want to share this one with the role development. What you got a strength? Have you got a good clinical knowledge, good assessment skill, good what strength you got? So then you need to find out what weakness you already got. You don't have a education qualification, you don't have a prescribing skill, or you don't have any this one. So the opportunities, how you can, if you become a nurse practitioner, what opportunity in your head, how you are going to use it, Then threat, who are going to be threat to your professional, whether your colleagues, whether medical colleagues, or whether other people. You need to analyze this yourself. You need to bring that one in the 4 areas. Then we need to think forward. So all the nurses, when they're starting the importance of the nursing development. So to provide high standard of care, already the nurse practitioner, why we need to bring this role development. Wow, what is the necessary ANPs? Already discussed, Suresh said, already Dr. Ramchandrappa said, already Roy said. So we need to give high quality of care to our patient and safe and effective care to our patient and provide, the better public service and, reduce to meet the, needs of the public. That's very important So how to do this role development? We need to have, we need to be focused on our career path, and we need to find out advanced opportunity, and we need to have the enough education, knowledge and skill means we need to be better qualified, and we need to be lead the role in further. We need to be take further steps. So this is the nursing career pathway in the research areas. When you are undergraduate, how you need to be, step by step. You can go as a clinical, nursing level. The step by step you need to be jump up. This is, I shared with you. Can, get information from the Google, further. So the nursing pathway, the how you are going to be, in UK, different level of the grade. Suresh is already said about it, the entry level, healthcare assistant, healthcare, the assistant practitioner, general practitioner, senior practitioner, and lead practitioner, and advanced nurse practitioner, and nurse partner. So the various steps you can, starting from the in UK, people will join as a healthcare assistant or ward boy or lower level. Then step by step their career pathway, they will go step by step. Then they will reach the advanced nurse practitioner. So this is the skill with the different level what they are doing, and the more information with this slide will tell. I will share with this one with you. Okay. What is ANP? ANP is already said. The definition you already understand is ANP is advanced nurse practitioner, experienced, highly educated person within the nursing practice is able to do the independent assessment, examinations, diagnose and treat and refer the patient appropriate specialty. And 4 areas of the practice he can do it: clinical practice, leadership, and education and research. So why we need ANP role is already know everybody. Shortage of the medical practitioner, increased healthcare demand, high morbidity and mortality, increased healthcare cost, rural area, international opportunities, and professional development, high standard of practice. So this is the areas very important. We need a nurse practitioner, and most important is the people can't afford at the moment. They are paying so much money to private sector, and people desperately needed alternative profession to fill this gap in India, and the medical part is very expenditure. For nurse practitioner, if they take the role, they can meet the public needs, and it's the good opportunity. So the nurse practitioner very desperately needed in India. It is so. So advanced will combine with the what is the we are telling we are already discussed about ANP, what they need to be. There is the high challenges in India we are facing is we got a highly qualified the masters, PhD holder, everybody's, but in the clinical areas the development is needed. In the clinical practice, in the academic, you can see PhD holder, MSc holder, so many teachers, highly qualified, knowledge is there. But in the clinical practice, that's not advanced. So need more growth, need more practitioner and more advanced clinical practitioner. So the practice need to be improved. So the advanced nurse practitioner is both combined with the theory and practice. We are the advanced nurse practitioner. We are seeing the patient, assessing, diagnosing, and treat them with the combined, means the knowledge of the theory, advanced skill, and we also teaching the other, the students and universities to provide, means it's combined. So nursing practices, if you want to successful nurses practice, should be theory and practice need to be combined together. But in India, So there is a huge gap is there, need to be addressed, need to be fulfilled this gap. So what is the entry requirement? Already Suresh said, I don't want to discuss much about it. So need a graduation level plus certain years experience. Experience is important, clinical experience, because so many people are graduated and postgraduate qualification. They don't know how to handle. They don't know the normal values of the blood pressure or normal values of the blood. They don't know the interpretation skill unless they without clinical practice knowledge, it is difficult for them. So when we are qualified from the master level education from India, when we came here, we are started to work from the beginning, means like a beginner, from the staff nurse. From the staff nurse, here in the practice, we are looking forward. We are identify the patient problems. We are started to the assessment skill and communication skill and the clinical judgment. It will learning from the practice. Then only we can able to become a good advanced clinical practitioner. So that is very important. So what we learn from there are two programs is there. One is post-graduation diploma and masters. So in the PG, we need to do the context issues and professional development. It will say what is the advanced practice and how it started. It's like a history type, how we need to develop the role. And history taking and physical examinations means we need to do the A to Z, means there are 9 systems. We need to do the physical examinations. We need to identify normal and abnormal. We need to discuss about the pathology, pathophysiology under that one. We need to both theory and clinical practice. We need to demonstrate like a OSCE. So the critical reasoning and decision making are another model. It is telling we need to the differential diagnose. It is like we need to present so many case studies. We need to assess the patient. We need to make the diagnose, and we need to justify why we are making the diagnosis. It is in this basis, these nice guidelines. We need to read so many different guidelines. According to that base, we need to justify our diagnosis and implement and supplement to prescribing. Prescribing is, the way, again, we need to should have the pharmaceutical knowledge. When you prescribe, you are the responsible person. You need to justify why you are prescribing. You need to understand side effects and, the indications and the side effects of the medication. You need to understand. You need to be prescribed according to especially when you are prescribing with the elderly, so many comorbidity, you need to understand all the medications you need to be prescribed. Advanced practice portfolios. This is the portfolio. I will be going to be next slide about the portfolios. So the total, the advanced PG diploma is 120 and the master degree is 180 credit. And you need to be in the master. You need to be present the project, you need to submit the project. I done the project regarding the management of the pain management within the emergency department. We need to do the edit, and we need to do the research, and we need to submissions of about 10,000 wordings project. And there are different models. We need to complete this one. Then what should be teaching faculties? Who should be teaching faculties? The advanced nurse practitioner, you better to get the teaching or support or directions from either who are trained advanced nursing practitioner, or who is the lead advanced nurse practitioner, or who is those people guide you, and appropriately they can teach you and And secondly, you should have the two mentor. One is the advanced nurse practitioner or lead advanced nurse practitioner or medical mentor. So that's very important. Where is the practice area? So both in the school or universities, and you should be in the hospital. At least you should have the good the strength of the bedding in the hospital. Like you need to be here. All the clinical department is which will expose you more knowledge, more experience, more practice. Or portfolio development. How you are going to be developed? What is portfolios? Portfolios should be obtained summary of your education license, and it is, I can say simple wordings, what you done from the first year till end of your completions of your course, what you presented, what you learn, and what clinical practice you done, and what every evidence you need to be put it in the big portfolios. And it will show the what you done from the first to last year, your performance, your the all the presentation, everything, it will come together. That is your portfolios. And even though if you are qualified as an advanced nurse practitioner, you got a master degree in your university, still you need to be learn so many things after your development and after becoming advanced nurse practitioner. Still you are continuing to maintain your portfolios is very important. So already I told who need to be sign off: your mentor, your medical mentor, nursing mentor, and clinical supervisor. There are so many different, the performer you need to be signed while you are as an advanced nurse practitioner. So the different level of the competency, because the bigger now me and the little experience or no experience, the before starting, the beginner who started just now, the competent, he's got some knowledge, he's able to, the proficient and expert. Expert is he's able to, if you give any patient, he's able to hand that patient, and he's got adequate knowledge, and he's an expert practitioner. To reach this level, and you need to be, even still some people are, maybe they got certificate, but they are still competent. Difficult to say there, because how much they got there in practical experience, they are able to make the clinical assessment, diagnose, judgment, depends on the practitioner to practitioner different. So this is the way we need to be make them, they understand the level of the practitioner. What is the legal challenges aspects of the practice? Clinical decision making. When you assess the patient, you made the diagnosis, you are discharge the patient. If something happens to the patient to go and die, who is the responsible? Okay. And in what basis you are going to be diagnosed, and who is gave the permission to you prescribe? Who is the legal authorities, whether it's INC or KNC or Government of India or Government of Karnataka, or who is this one? And which prescribing policy you are going to be followed, and which sources you are going to be refer. And if you done or misdiagnosed, you are going to be end up with the ethically responsible for family, and end of life we are going to be struggle for the stress and feeling. So this is all the challenges. Unless you don't, when you take the advanced nurse practitioner opportunities, you need to be learn and acquire as much as possible knowledge there and practice, and you need to be make the accurate and good diagnosis. Then that is very important. So we need to be look about this one, who is who is giving the authorization. The medical council, they are giving the authorization for medical practice. As a nurse practitioner, nursing council also need to be take the responsibility, and they need to be right up, the sign up for nurse practitioner role. And finally, whatever we learn, whatever education it should not be for a certificate base. And so many people are qualified, even they don't know how to handle the patient. That is really waste of money of the student. But while a student, you should learn properly. Don't waste your time not to learn. And you should be productive for the public and to help the public. And it should be reflective, means you should be model and you should be identified in the society. And the student able to practice after qualifications and continue future personal and professional development is important. They need to be contribute the profess to help and support for further. So this is the way the role development we need to be done it, and we need to be future. The advanced nurse practitioner should be developed in India, but it should not be like a other, the profession like should not be given like a certificate, but it should be once we done this advanced nurse practitioner in qualification, the people should be contribute to the public. It should be highlighted. Thank you very much for me to speak, few minutes or to share my knowledge and skill with you. Thank you very much.
Thank you, Mr. Raghavendra Kambli, for sharing the information and the role development as a nurse practitioner. Thank you, sir. Nursing in the modern era is the greatest platform for gaining knowledge, shaping the psychological thinking, vision and mission of advanced nursing practice. I welcome Professor Sridhar KV, Principal, College of Nursing, Adarsh University, Punjab, to speak on nurse practitioner and critical care course practices in India. We welcome you, sir.
Good afternoon, everybody. Hello, good afternoon. Can you hear me? Hello? Can you hear me? Okay. Good afternoon to everybody. So I'm grateful to the organizers providing me an opportunity to talk about this topic. I heard the experts who spoke before me who already highlighted the concept of advanced nurse practitioner and how it is being implemented in Western countries to practice at the tertiary care hospitals. With this concept, they introduced the concept of what we call as nurse practitioner critical care program, a 2 years postgraduate residency program. The whole curriculum is based on developed or designed in such a way 85% of the curriculum is practical oriented and only 15% of the curriculum is theoretic based. And the aim is to see that the students who pass out of this program will come out with a strong clinical knowledge, strong clinical competence, and a sound theoretical knowledge, and should also be capable of making complex clinical decisions. And I'll give you one example. Most of the time, I'll explain to you based on the example. Take, for example, a patient comes to the critical care unit and with a chest pain. A nurse practitioner should be capable of deciding or differentiating whether the person is suffering from angina or the person is suffering from myocardial infarction by recording an ECG. And if she knows, if she's able to identify the fact that or diagnose the patient is suffering from myocardial infarction, she should be able to send a sample of blood for cardiac markers, that is TROP-T test. And based on the result which she gets it, she should be able to prepare the patient for a thrombolytic therapy. And before the consultant comes, she should be able to administer a narcotic analgesic to the patient and, of course, administer aspirin and oxygen. This is what the competency we expect in a nurse practitioner. And I'll give you another example. Take, for example, a patient comes with a myasthenia gravis or a Guillain-Barré syndrome. And she should know that, or she should be able to anticipate this patient might be able to go into a state of respiratory distress at any point of time. And she should be ready to keep the required equipment night. She should be able to intubate the patient, connect the patient to the ventilator. And I'll give you one example, another example. Take, for example, a patient comes to you with this poisoning, and she should know how to stabilize the patient, and she should know how to neutralize the poison, how to dilute the poison, how to initiate measures to eliminate the poison, or possibly how to initiate the measure to reduce the absorption of poison. This is what the competency we expect from a nurse practitioner, and that's how she will be trained. She should also be trained in such a way that she should be able to prescribe medications based on the sound pharmacological knowledge. But what exactly is happening at the ground level is that only few colleges have been authorized to run this program. And when the INC inspectors came to our own college, in fact, they had a meeting with all the consultants. The message was clear. The program will succeed only if it's run in a manner in which it has to be run. In other words, the students who are enrolled to this program should be provided that kind of training and should be able to provide that opportunity to practice independently. If that is not done, the program fizzles out. And that's what is happening in most of the places, because most of the hospitals recruit these students as a manpower supplement to man the ICUs, but they are not being provided the real opportunity to learn or as independent practitioners. Since that is not being done, and though the program started with such a big fanfare and such a big enthusiasm, over a period of time, the students have lost interest because they are not being authorized to, or they are not being permitted to perform those activities which was told to them it will be done at the beginning of the program. So what I'm trying to tell here, everybody, is that the nurse practitioner critical care program in India will succeed, provided it is not being dominated by the medical profession. And of course, it's a sufficient amount of opportunities are provided to the students to learn how to intubate and how to record an ECG, how to interpret the ECG, prescribe medications. If all these opportunities are given to the nurses, and if they are able to be prepared as an independent practitioner, we do hope this program will succeed in India. If this is not done, then possibly the nurse practitioner program, which has been started by Indian Nursing Council with such a big fanfare and such a big enthusiasm, possibly may not succeed. So what I request is that the medical professions not to dominate. Of course, most of the people, what they think is that when we have junior residents, when we have senior residents, why a nurse should do these things? Fair. There are junior residents, there are senior residents, we don't deny, but they may not be available always in a critical care unit. Since they are not always available in a critical care unit, a nurse who is there 24 hours in the critical care unit should be capable of performing these activities. That is, when a patient comes to you in a critical state, take for example with a severe chest pain, she should know what has to be done for this patient. She should be able to administer a narcotic analgesic to provide a relief from the chest pain. She should be able to send a sample of blood for TROP-T test, record an ECG, interpret an ECG, prepare the patient for thrombolytics. All these things she should be able to do. And for that, she should have adequate leeway and she should be permitted to do those things. If those things are not being permitted, and if she's not able to, since though she knows if she's not able to implement, then ultimately, possibly, they will lose interest in performing this activity and the program doesn't succeed. So that's what is happening at the ground level today at the nurse practitioners program. Though around 35 to 36 colleges have been granted permission, what we see in most of the colleges is that admissions are not taking place. Why the admissions are not taking place? Because this program is being run like just any other MSc program. What everybody should realize is that a nurse practitioner program is not a type of program. It's the level at which the nurse practices. And for that, she should be trained. She should be given an opportunity to practice, and a separate cadre has to be created in hospitals so that they will be able to perform at that level. If that doesn't happen, this program doesn't succeed in India the manner in which it has succeeded in the Western countries. So my sincere request for the medical faculty or medical fraternity is that give that opportunity. Don't deny that opportunity for the nurses. If that is done, possibly this program will succeed in India. Thank you very much. Hello.
Smile, it makes you attractive, it changes your mood, it relieves stress, and it helps you to stay positive. Every woman's success should be an inspiration to another. We are strongest when we cheer and raise for each other. There is something so special about a woman who dominates in the man's world. It takes a certain grace, strength, intelligence, fearlessness, and the nerve to never take no as an answer. We are extremely glad to have such a wonderful person to be the part of our effort, who had been a role model, motivator, and inspiration to a lot. I would like to welcome Dr. Vidya Raju Salyam, Principal, Bowring and Ladies Crescent Hospital, Bangalore. We welcome you, ma'am, to address the gallery.
Good afternoon, everyone. First of all, I have to thank my guru, Dr. Tresiam. She is my guru I studied in BSc Nursing in Government College of Nursing. And congratulations, the Ebenezer group of institutions, because they conducted such a wonderful international webinar. So it is at present it is very important, because somewhere we are losing our professional ethics principles. So it is nowadays it is very interesting subject. So the World Health Organization estimated that more than half of 1 million women lose their lives in the process of reproductions. Yes, today's my subject is the advanced nurse practitioners in maternal and child health. Yes, it is started in 2015. The India, that is a 193 countries commit to sustainable developmental goals. The aim is to transfer world 2030. There is a more equal, more secure and planned for everyone. When pregnant woman enters the health system, she puts a faith in the system of receiving high quality care and receives some safe and safe newborn care. The maternal mortality rate is in India 113 for 1 lakh live births, and infant mortality rate is 27.69 for 1,000 live births. Last speakers, they given information regarding all those things. Then the developmental goal launched the Laksh program in India. The labor room, the maternity operation theatre quality initiative programs, nurse practitioner programs is in pediatric. It is started in 1965. The pediatric nurse practitioners can provide care for in various stages like during pregnancy, childbirth, postpartum, and family planning care and gynecological problem. The advanced nurse practitioner undergone dramatic growth and changes during the first quarter century. Specialization in maternal and child health started in hospital, developing programs. First of all, I want to share my clinical experience. I was working in PSC. There that time we have the freedom to conduct the deliveries. Now that also the doctors are not allowing to conduct the deliveries. Even PGI Chandigarh, there they have the opportunity. There is some protocol. Even immediately the newborn care they can give. And if intubations also, nurses can do the intubation care. So this type of protocol is needed in government setup. So as a government officials, I am requesting with through this webinar, there is some protocol. If it is guiding protocol is necessary in all the setups of in critical care units. The maternal child nursing is a specialty focused the care of women throughout their pregnancy and childbirth and care their newborn children. The importance is providing comprehensive, promotive, preventive, curative and health rehabilitative services for mother and children. The objectives of this MCH is to promote and protect the health of the woman during pregnancy, to detect high risk. This is possible for the nursing fraternities if she will get the training, to teach mother how to take care of the baby and what type of nutrition she can take and what are the personal hygiene she can do after delivery. Then the aim is to ensure complete health care to all children. It is very important. Even community level, if you are advanced nurse practitioner course is very essential, because nowadays doctors are not going for the community health sectors because there is a lacking of the doctors care in the community health sectors. So if they are giving chance to the nurses, even last time so many 10,000 posted community health officers, if we are getting the freedom, so we can do the wonders in the community level. Next one is to ensure health care the women during their reproductive system. So that's why one word is there, the nurse practitioner, the doctor is the brain of this system and the nurses is the heart. So heart is very important. She's have the empathy, sympathy, so many things qualities have the nurses have. So our government, I'm requesting through this, our government giving the chance to do the nurse practitioners in India. It is very helpful for our healthcare system. Then the nurses, they are the monitoring the children's and support the maternal and child well-being and providing interventional programs and referral systems, delivery, health promotions, providing parenting support, promotions, and 24/7 she is working with the patients. So it is more helpful for her. And even screening, even children ward, we are working. So we are screening so many congenital anomalies we can observe, and we can detect the some programs. Nurse can, as a nurse can practitioners, she can work like a administrator. But we are not getting till, but still we are working as a information we are giving, and we are liaison between the government and community and some NGO programs, and develop counseling programs and create network PSC. When PSC level, so many works we are doing, and develop MCH advisory committee at all level, and reserve financial package for the mothers. Then as an educationist, she can organize training program. Yes, what the Ebenezer group of institutions last immunization, as well as that pandemic, COVID, during COVID period, you are giving, I think, your health checkup, everything you involve. The nurses are involved more in this program. Develop separate channels in order to sensitize the public in MCH programs. As a researcher, she is a coordinate, and she has have the network research activities, support research scholars, and undertaking research in some MCH programs. Then some government have initiated some programs. That is the Surakshita Maternal Matratva Abhiyan. It was launched in 10th October 2019. See, these are the government programs. People are, it is reaching by the nurses only. They can educate, they have the some programs they have to compensate, they have to do. See, this is a comprehensive program, multi-programmed program, and it is assured by the free cost services the patient will get and delivery. And Suman is the initiative by the government ensure quality maternal and infant health care systems. Then Pradhan Mantri Surakshita Matratva Abhiyan. It is a program is conducted in the June 2016 to reduce the maternal mortality rate. So the maternal mortality rate is reduced to ensure qualitative maternal health services, and various program schemes are be initiated. All essential antenatal examination. Yes, it is very, very important to check the hemoglobin, urine, routine, and blood sugar, and malaria, HIV, all those things when antenatal mothers is exposed to come to the examination. So she have to do. As a nurse, she can do all those things. Then Janani Suraksha Yojana. This is already is implemented in government setup, and this scheme is 2005 only it is implemented. The government that in BPL card, who have the BPL card, SC and ST families, that is regardless of age and number of children. The government is paying 700 in rural beneficiaries and 600 for urban beneficiaries before 8 weeks of delivery. Okay, that is a Janani Sishu Suraksha Karyakrama. This was launched in June 2011. This is also same thing, free drug, free the diagnostic services, free diet, and free provision of blood transmission, and all type of services she can till she is after delivering. If referral system also, everything is free for her. Then Chiranjeevi Yojana. The scheme is launched, the pilot study in December 2005. The Health and Family Welfare Department is initiated. Here also same thing, everything is delivery, primary sources, socio-economic groups, they are getting everything is free. So on this regards, you give an opportunity for me. So my request with all the eminent resource persons you involved in this program. So my request, in India, we have to initiate, we have to day by day. This is the first step, what the Ebenezer group are for doing. This is the first step we are putting, and day by day we have to show what we have challenges we have to face. Thanks once again, the organizer. You give an opportunity, and you think I am the one member of this institution. Okay, thank you.
Thank you so much, ma'am, for your wonderful messages. Goals are important, but it's the aha moment on the way to the goal that have taught you the most things. We are esteemed to have such a distinguished personality as our head leader, Professor Dr. Tracia Dennis, Principal, Ebenezer School and College of Nursing, to address the gallery on the topic benefits of advanced nursing practices in community health setting. We welcome you, ma'am, to address the gallery.
Good afternoon. Namaste. Greetings to all. It's a proud moment. It's coming to me, many experts, those who are connected with Ebenezer and the profession, have taken the pain to explain the concept of advanced nurse practitioner, that role in India, especially to the community settings. I congratulate wholeheartedly today and greet everyone on this auspicious occasion of our second international webinar on behalf of even Ebenezer School and College of Nursing. At the outset, I would like to take this opportunity to thank each and everyone have taken the pain and coordination for the success of this international webinar, Vision on Advanced Nurse Practitioner for Future Healthcare Solutions in India. If we look back, speaking about nursing or nurse practitioners, the roots of advanced nurse practitioner or advanced nurses traced back to 18th century, 1890s. There's a piece of evidence. Expert practice nurses practiced during the Florence Nightingale era. As you all know that nursing is a versatile profession. Since from 1860, the Florence Nightingale's era, and Florence Nightingale is the first community health nurse. She's voice raised for the doorsteps practices during 18th century. Today, the concept have changed. A lot of changes occurred. Not 18th century, we are in 21st century. Lot of technological changes occurred. And the nurse practitioner, since centuries, they are practicing, decades practicing in Western countries and Eastern countries. Why it is not possible in India? Why it is lacking the support? Why there is no system functioning or working for healthcare solutions? This is what the concept we raised today. As our topic, I congratulate Mr. Raghavendra, a nurse practitioner from India working at UK, the emergency settings, and he is coordinating for community programs to serve the community. That inspirational one word took us to conduct this webinar today. With his inspiration, he has given one more expert, Suresh Babu Periyaswamy from Tamil Nadu. And for 21 years, he is doing the excellent work there at UK. Why our nurses are going to other countries? Why can't we keep our brain, our intellectual, our practical nurses in India? Why people are not looking for that? Since it is started many years, even more than 130 years, this concept, why it is not possible in India. Many people raised the voice, but the level gaps between theory and practice, theoretical and practical knowledge varies, and lack of resources, lack of facilitators, lack of political support, lacuna in consistency. Otherwise, Indian people commitments how other countries are enjoying. How the Indian people love other countries' people to do the service. Why it is not possible in India? It has to be implemented. Even today, it is raised the voice. It may take another 5 to 10 years or one more decades, one more generation. We have to see that it has to be seated in the settings. This is what our aim and objectives. For the reason we are working for 24 hours and 365 and quarter days. In this Ebenezer, they are meant for that. And involvement in service, not only for theoretical aspect, we are keeping 80% practical aspect and 20% theory aspect. And earlier NPs utilized the models, different models for assessment, diagnose, and treatment. But now the code of conduct, the code of ethics, and other details of the evidence-based studies we are getting across the global, and we have enough stuff to work, to do commitment, to do love towards the services in the rural settings and even in the area of outpatient settings or the specialization settings or the physicians of health in the family settings. Why it is not possible in India? As per my experience in public health nursing over a period of 19 years, and the statistics which shows that 3 to 5% of patients coming to hospital or admitting to hospital needed emergency surgeries or the ventilator care or ICU care or the organ transplant. The remaining 95% of the population or the patients, those who are coming to hospital, not required that emergency medicine or emergency procedures. So there, why can't our nurses, which way they are less than consultant, which way they are less than physicians? They have the basic qualification of 4 years residential or collegiate programs and master's degree in critical care nursing. And there they will be getting the exposed to 3 to 5 years of experience with under supervision of physicians and experts. An expert APNs are capable of assessing patients' health conditions, observation or actions or reactions of the patients, or what will be happening, the brilliant brain, expert knowledge, and practice aspect immediately it starts working with compassion. What my colleagues, they said, the heart, nurses are the heart of the institution, and doctors are the brains. And the problem what we are facing in India, and what are the benefits of APN or the advanced nurse practitioner in India? First of all, they can come across, they can come out, and numbers, quantity is very high, considering with specialized doctors in the rural settings. specialized doctors are very least. What my colleagues, even Dr. Vidya highlighted MMR, maternal mortality rate, and infant mortality rate, where we are standing. Out of 200 countries, we are in 138th place, 132 place. That means we are still move on the days to come. We should have a dream that the fine day will come. This has to come down to 0 level or 0 to 5%. In that, it should be, there should be people to stand for the family practitioner, counselors, health educators, and emergency practitioners to come down, to take this pain of the people at the moment of emergency, which we have seen since from 2 years. We know how very sadly tragedy happened in front of our eyes. Our Ebenezer College will be taking that little bit pain to support with materials, with services, with available resources, and we cannot simply sit something happening to the people in general and in front of our own environment. How is our ecological system works? How the pandemic taken millions deaths, millions life. Our own colleagues, our own doctors, our own specialist people. We lost many lives. It is our loss. We can't regain that loss. We will not get this kind of pandemic or the tragedies or the disaster, natural calamities. There is manpower, human resource is very essential. Since from 1978, primary healthcare concept came into existence in the whole world, and we have 20 goals and objectives and Millennium Development Goals. After then, the Sustainable Development Goals. Why these goals are not achieving? What is happening between these objectives and goals? Who is implementing and who will be working for this sorting out these problems? Here we need to work on selfless, committed service, human care, not on the practice or practitioner, this and that, cadre-wise. And there should be some respect for nurses and the benchmark of their salaries and their economic background. These areas need to be upgraded by the system of India. Then only the people can come out, take the seat, NPCC or the primary health care or the midwifery courses, and there should be recognition and license to practice openly. It has to come out with practices. I know how my children are there in America. Since for 12 to 15 years, my son and family, even my relatives, 25 families, settle in America. They are very comfortable and excellent service. They are always saying why this system is not possible in India. We are very comfortable, excellent and competent, confident nurses in US, and most of them are from our Kerala, our mother India, our Kerala people. Why it is not possible in India? Throughout India they are working. Why it is not possible by Indian government to keep them back to India? This is our question we are raising today. And lack of support, lack of encouragement. It may be physically, mentally, socially, financially, economically, all the reason that when the system comes to the place, economic system and cost effectiveness of healthcare, definitely it will come down the 50%. Now how we can enter to a hospital? We should have a policy or insurance, or we should have pocket full of crores or lakhs of rupees. This business, that commercialization has to come down with this practice, and I hope this will be possible. This will be possible that that's correct and the appropriate concept this we have initiated from our Ebenezer College of Nursing will be stand for anyone will be coming for any support, any kind of support we are ready to take up. And every obstacles highlighted by Mr. Raghavendra and the concept by Mr. Suresh Babu and the problem NPCC from Professor Sridhar KV and Dr. K. Ramu, our Dean, Rajiv Gandhi University, and our chief guest, Dr. Roy K. George, have highlighted the possibilities and inspirational speech that this is possible in India, and the obstacles we have to come across, we have to come out with crossing with competent people from nursing, competency and confidence. It will come through the support and encouragement from political system and other healthcare professionals' supports. I hope definitely our nursing people will be practicing or have the confidence they will practice, change mindset and come to the career, take up the career. Mindset have to be changed, take up the career set and practice confidently, change the cadre or change only nursing, I'm an assistant. That need to be changed, do good services. Jai Hind, Jai Karnataka. Best wishes to all nursing professionals. Thank you all. Thank you.
Thank you so much, the backbone of our Ebenezer Group of Institution, Dr. Tracia Dennis, for your wonderful and inspiring words for us. As we express our gratitude, we must never forget that the highest appreciation is not the utter words, but to live by them. It is requisite to express the gratitude to everyone. I invite Professor Kavya R to express our homage to all the expertises, professionals who supported this event.
Good afternoon to one and all gather here. On this wonderful afternoon, myself, Kavya R., Assistant Professor, Ebenezer School and College of Nursing, I would like to thank each and everyone present here. It's my pride for me that I get a chance to thank everyone present here. I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. I extend my gratitude to our Honorable Chief Guest, Dr. Roy K. George, National President for Trained Nurse Association of India, for taking time for his busy schedule to grace this event. Thank you for inspiring and encouraging us with your words for this special day. Thank you so much, sir. My sincere thanks to our honorable special guest, Dr. Ramachandra, former professor and head of the Department of Nursing, NIMHANS, Bangalore, for the inspirational, valuable thoughts and encouraging words. Thank you, sir, for sharing your viewpoints on nursing professions, nursing transformation in various fields, and even sharing a personal experience regarding nursing practitioner and comprehensive care. Thank you so much, sir. We are very blessed to have you in our webinar. Thank you so much, sir. My heartfelt thanks to Mr. Suresh Babu Periyaswamy, Advanced Clinical Practitioner, Emergency Department, Registered Royal Infirmary, UK, for giving such a valuable information on concept of Advanced Nursing Practitioner in healthcare. Thank you, sir, for sharing brief history of advanced practice and introducing us with the different roles of nursing specialists in delivering high-quality nursing care. And sir explained in brief on advanced nursing practice, and for guiding us how after master degrees, how we want to practice and experience in our specialization, and how to become a independent authority practitioner. It was a wonderful experience with you, sir. We got a wonderful exposure, and we are very blessed to have you in our webinar. Thank you so much, sir. I take this golden opportunity to thank Mr. Raghavendra Kambalu, Advanced Clinical Practitioner, Accident and Emergency Department, Newham University Hospital, London, for such a mesmerizing speech on developmental roles and challenges in India. Thank you, sir, for sharing your aims, objectives, roles development. So nicely, sir, explained how we are going to analyze our strength, weakness, and where we will get the opportunity, and what and all our threats, and also for the need of advanced practitioners in India. It was an awesome experience with you, sir, for being a part of our webinar. Very thank you so much, sir. I take this privilege to thank Dr. Ramu K. Dean, Rajiv Gandhi University of Health Science, Principal RR College of Nursing, Bangalore, for sharing a wonderful concept of how to implement the nurse practitioner in India. Thank you, sir, for sharing a vast knowledge on healthcare system in various fields and why India is risk of lacking health sectors because of migrating the nursing practitioner, and for sharing how India is implementing nurse practitioner by various programs. We are very happy to have you in our webinar, sir. Thank you so much, sir. My sincere gratitude to Professor Sridhar KV, Principal, College of Nursing, Adesh University, Batinda, Punjab, for telling us how nurse practitioner critically care course practice. Thank you so much, sir, for sharing curriculum of advanced nurse practitioner in critical care course, and for sharing practical aspect in the field of critical care with the real examples. So how nurses practitioners should be trained to fulfill these high quality care. Thank you so much, sir. We can hear your speech whole day. That was such an awesome experience with you, sir. Thank you so much for being with us. My heartfelt thanks to Dr. Vidya Raju Shalyan, Principal, School of Nursing, Boring, and Lady Curzon Hospital, Bangalore, for sharing the benefits of advanced nursing practitioner in maternity and child health sector. Thank you, ma'am, for sharing brief history of maternity and pediatric nursing practitioner and for sharing a personal clinical experience in the field of maternity and child health care, and introducing government comprehensive programs implemented for the benefits of high quality care. It was an awesome experience with you, ma'am. Thank you so much, ma'am, for being with us. A special thank to our lovely principal, our backbone of our college, Dr. Theresia Dennis, for sharing the great knowledge on benefits of advanced nurse practitioners in the field of community health setting. Such an inspirational speech. We are very thankful to have you here, ma'am, and for bringing such an eminent person for this webinar and for this journey of webinar, for support and guidance. We are very heartfully thank you, ma'am. I would like to thank Mr. Sanjeev Chincholi, Mrs. Sanjeev Chincholi, Mr. Pankaj Roy, Executive Director, Mr. Lofi Lona Vellara, Chief Executive Officer, Mrs. Neetu Vellara, Director of Admission. Today's program MC, Miss Elba, conference committee members, technical team members, staff, student, and who made this event more interesting by their presence, our beloved participants for making this conference as a grand success. Once again, I thank one and all, thank you. By this, we will wind up our webinar. Thank you so much for everyone.